The Association of Community Pharmacists of Nigeria says government should provide quality healthcare services at the primary healthcare level. The National Chairman of ACPN, Pharmacist Dr. Adekola Oluwaromopin Samuel, made the pronouncement at the Pharmacists Week celebration in Abuja. He said government should place high value on primary healthcare system as it is the first point of call at the community level. He says community pharmacists should update themselves with relevant skills on the job, especially during COVID-19 pandemic.
We have not enjoyed the kind of support we should have enjoyed from government. This is very unfortunate, because if countries like America that were more developed than us in terms of their sectors, in terms of their health system, and even having have more practitioners. Today, you can count the numbers of Nigerian doctors, pharmacists who are in America, and if America is taking benefit. One of the presidents of America at the time in the 60s says, that pharmacists are so important that if we do not have one, we may have to invent one. We may have to manufacture one. But unfortunately, in our own climes, in Nigeria, this has not happened. We have not enjoyed the support of government in this regard. We are doing them. We are doing this. There are researches that have been done by even partners, by even government agencies, to the effect that 70% of people who are consumers of health in Nigeria access their health, services from community pharmacy. Unfortunately, because of the lack of team spirit that exists in the health sector in Nigeria, where a particular group of healthcare provider sees health sector as their own. So any other person is very relevant, except we have a renewed commitment. For the side of government to say no, everybody's important. Let us take benefit of everybody. These guys we wouldn't mind to give even people who are not trained, who do not have more than perhaps education beyond let's even say school of health tech to manage a facility. But when it comes to a pharmacist that spends 6 years in the university and 1 year internship training, just like medical doctors or their colleagues, when it comes to giving them the hand of fellowship to express their potential, you see what our health sector look like. And that is because there has not been team spirit. We have not appreciated insight. We have not pushed the patient at the center. Rather, it has been, ego of professionals in the system. Okay. This is exactly what we're telling Nigerians, that there are potential. Community pharmacists is the most accessible, highly trained, skilled professionals. Healthcare professionals. And there is trust. We are community leaders. So we have all of this with us. We influence people in community where we serve. So all of these are things that government are expected to tap into so that all this potential can be maximized to the benefit of the people of Nigeria, and so that together we can achieve universal health coverage.
Former President of Community Pharmacist Hamzat Omotayo says that universal health coverage will ensure the attainment of sustainable development goals. He said primary healthcare services is essential to all Nigeria as it supports families and community in accessing healthcare services.
We know about the pandemic that almost wiped the whole world. A lot of countries have initiated the COVID vaccine the COVID vaccine initiative, and they are making use of community pharmacists so as to reach out to large number of the population within a very short time, knowing that the pandemic is an emergency that needs to be handled headlong. But in our country, that we are not seeing yet. And I believe that's one of the reasons the number vaccinated in Nigeria so far is very small compared to other countries and compared to our population. Are underutilized. The pharmacists, particularly the community pharmacists, are underutilized. They are well trained and they have all the professional and technical know-how to handle vaccination and other primary health challenges. What do you think is that? I would say yes and no. I think a big factor why it's like this is because of the interprofessional feud among our healthcare professionals. As we know in our country, the doctors are always at the helm of affairs, and they want to have it all. They want to be the only ones to be recognized. But the truth again is, in health practice, the patient should be key. It should not be about self or about self-recognition, but about what is good for the patient, what will the patient benefit from.
Is there any form of adverse effect of this drug? You didn't mention if there was any.
Any other question on projects, let's say side effects and all of that, because like I said, it's an analgesic to go with, to take care of that. And of course, we recommend all the non-drug therapy. The patient should rest. For children, there is no challenge. It's only for the adults. You are not allowed to take it with your BP medications because it increases.
As to curbing the sale and distribution of fake products, with regards to this fake products, is there anything that you guys have done with regards to the authenticity of?
Okay, so thanks for the question. How do we curb fake and substandard getting it? So in Novartis, we make sure that
ameliorate anxiety and depression disorders. And we know that in